I feel like usually when we talk about a medical diagnosis, there's this, I don't know, this expectation of total precision, like it's engineering or something.
Right, yeah. Like it's a math problem.
Exactly. Like
Huh.
you break your arm, the x-ray shows that jagged white line, and the doctor just points at the screen and says, there it is.
Yeah, it's very binary. It's visible. It's categorized. And honestly, that's comforting for a lot of people.
Oh, totally. But when you step into the world of bodily fluids or hormonal shifts and severe vaginal atrophy, that x-ray machine is just fundamentally broken.
Oh, completely broken.
You're looking at a diagnostic landscape that is just entirely murky. So today, for you listening, we are doing a deep dive into a stack of medical journals, clinical reviews, stuff from Frontiers and Stat Pearls, and some really fascinating expert Q&As.
Yeah, the source material on this is incredibly dense, but so revealing once you actually break it down.
Right. And our mission today is to solve one very specific, highly misunderstood biological mystery, which is when severe vaginal vault atrophy sets in, what exactly is happening to cervical mucus?
It is, I mean, it's a phenomenal question. And it's one where the actual mechanics are almost completely obscured by these really generic symptom lists.
Yeah, exactly. Like we constantly hear about the macroscopic effects of hormonal shifts, right? Hot flashes, mood changes.
Right, the big obvious stuff.
Yeah.
But the microscopic reality, like the exact chemical changes to these fluids, is profoundly complex. And it's rarely explained clearly.
Which is exactly what we're going to untangle today. Because when you actually look at the biochemistry, it completely changes how you understand the body.
It really does. It's a total paradigm shift.
But, to understand how the system collapses during severe atrophy, we can't just start with the symptoms. I feel like we have to look at the machinery when it's running perfectly, right?
Absolutely.
Right.
We have to establish the healthy baseline first. And, well, during the reproductive years, that baseline is dictated entirely by one master regulator.
And that's estrogen.
Specifically, estradiol. Yeah, I mean, it is the engine driving the entire urogenital tract.
Okay, so let's unpack the mechanics of that engine. How does estradiol actually build that healthy environment?
So when estradiol levels are high, they basically instruct the cells lining the vagina and cervix to constantly multiply and stack.
And these are the non-keratinized, stratified, squamous epithelium, right?
That's the one. Yeah, a mouthful, I know.
Yeah.
But imagine layers upon layers of bricks, making the tissue incredibly thick and robust.
Okay, I'm picturing it.
And it's also highly elastic, thanks to healthy collagen and elastin fibers. Plus, it's full of these accordion-like folds called rugae.
Right, and those rugae, they're what allow for distensibility, yeah, like the ability for the tissue to expand and contract safely without just tearing.
Precisely. They give the tissue its structural memory, basically. Its flexibility.
Reading through the cell biology in these clinical reviews, it almost felt like, I don't know, like looking at a microscopic ecosystem.
How
Well, I kept picturing this whole environment as a lush rainforest where, like, estrogen is the rain.
Oh, wow. Yeah, that's a highly accurate way to look at it, actually. I like that.
Right. And so the rain, the estrogen, feeds the plants, which in this case are those thick layers of epithelial cells.
Right, because when those cells are stimulated by estrogen, they produce and store a sugar called glycogen.
Exactly. And that glycogen is essentially the food source for the local wildlife.
Wildlife being the beneficial bacteria, primarily the lactobacilli.
Right. So the lactobacilli, they just gorge on this sugar. And as a byproduct of eating it, they secrete lactic acid.
Which is so crucial.
It really is. That lactic acid is basically the chemical shield of the entire reproductive tract. It keeps the environment perfectly balanced, highly acidic, and protected.
Yeah, it locks the pH right in that sweet spot between 3.8 and 4.5.
It's just a beautifully self-sustaining loop. The estrogen rain ensures the glycogen feeds the lactobacilli.
And the lactobacilli maintain that acid mantle. It's brilliant. And in that perfectly acidic, estrogen-rich environment, cervical mucus just thrives.
Because it's produced by those specialized secretory cells, right? Down in the crypts of the cervix.
Exactly. And when this system peaks, which is usually right around mid-cycle, just before ovulation, that mucus becomes incredibly abundant. It's clear and it's highly stretchable.
Oh, and there's actually a specific term in the literature for that stretchability, isn't there? I remember seeing it in the sources.
Yes, Spinbarkeit.
Spinbarkeit.
Yeah, it's a German term. It literally translates to the ability to be spun. It refers to that very specific, stretchy, almost raw egg white consistency.
But, I mean, it's not just stretchy just for the sake of it, right? Mechanically speaking, what is that stretchiness actually doing?
It's creating a biochemical highway.
A highway.
Yeah, the long molecular chains in the mucus, they literally align into channels. And those channels allow sperm to swim rapidly through the acidic vaginal environment and straight up into the uterus.
Wow, so it's basically giving them a fast pass lane.
Exactly. That specific viscosity and structure are entirely dependent on a high estrogen environment. I mean, it is chemically designed to facilitate penetration and maintain fertility.
Okay, so we've established the healthy baseline. We've got the lush rainforest, the thick folded tissue, the acidic shield, and this highly specialized stretchy cervical mucus.
Right.
But, and here's where the reality of our deep dive really sets in. What happens when the rain suddenly stops?
Well, the short answer is the ecosystem collapses.
Just like that?
Pretty much.
Right.
I mean, in a menopausal woman or, say, someone who has undergone a bilateral oophorectomy, which is the surgical removal of the ovaries, or even after certain intense cancer treatments, there's an approximate 95% decline in estradiol levels.
Wait, 95%? I mean, that's not just a gradual tapering off, that's pulling the plug.
It really is.
If this tissue relies so heavily on estrogen to maintain its fundamental architecture, doesn't that sudden drought just decimate its structural integrity?
It does. It absolutely does. It triggers a massive and, honestly, a pretty violent structural cascade.
Because the receptors are everywhere.
Right. The female genitals have such an incredibly high concentration of estrogen receptors,
Yeah.
so they are disproportionately affected by this drop. Without the estrogen engine telling those epithelial cells to multiply, that thick, robust brick wall of tissue just stops regenerating.
It just stops.
Yeah. It thins out dramatically, sometimes down to just a few cell layers.
Ah, that sounds awful. And what happens to the physical shape of the vaginal vault? Because the sources mention it actually shrinks.
It does shrink. The vaginal vault becomes noticeably shorter and narrower. And those accordion folds we talked about, the rugae,
Yeah.
they flatten out completely. The vaginal walls become entirely smooth, they get pale, and they lose almost all their distensibility.
You mentioned collagen earlier as part of the elasticity. Does the lack of estrogen affect that directly too?
Significantly, yeah.
Yeah.
Without estrogen, the elastin fibers physically fragment, they break apart, and the collagen fibers actually fuse together.
They fuse. Sounds so painful.
Imagine taking a flexible rubber band and replacing it with rigid, dry twine. The tissue literally loses its ability to stretch. And furthermore, the localized blood flow drops drastically.
Okay, so let me get this straight. You have tissue that is rigidly fused, completely lacking in blood flow, and stripped down to just a few microscopic layers. That sounds incredibly fragile.
Fragile is the exact right word. In a clinical setting, we actually call this tissue friable.
Friable, meaning it just crumbles.
Basically, it is so delicate that even the most minimal friction can traumatize it. It easily develops petechiae, which are these tiny microhemorrhages, as well as ulcerations and active bleeding.
Wow. And this widespread impact, this total architectural and mechanical shift, this is why the medical community has finally moved away from calling this atrophic vaginitis, right?
Exactly, because vaginitis just sounds like a localized infection, like a temporary bug you caught.
Right, which this definitely is not.
Not at all. The updated terminology is genitourinary syndrome of menopause, or GSM. Yeah. It acknowledges that this is a systemic syndrome. It affects the entire pelvic floor. It's not just the vagina. It's the bladder, the urethra, everything that relies on those estrogen receptors.
So that really explains the massive spectrum of symptoms that come with GSM. Like, the sources list things like dysuria and dyspareunia. For anyone listening who hasn't encountered those terms, what exactly are we looking at there?
So dysuria is painful or difficult urination.
Okay, because of the tissue thinning.
Exactly. The urethral lining is thinning and losing its protective mucus, so urine, which is naturally acidic. It physically irritates that raw, exposed tissue.
Ouch. And the other one, dyspareunia.
That's painful intercourse. When the vaginal vault is narrow, rigid, and highly friable, any penetration causes microtears. It leads to intense pain.
Okay, let's unpack this then. If the tissue is literally flattening out, fusing, and tearing because the estrogen is gone, how is the body still producing fluid?
Ah, right.
Because this brings us to the core mystery of the deep dive. If you need the rain to make the fluids, what is happening to the cervical mucus?
And this is exactly where so much diagnostic confusion happens, both for patients and doctors. Because women experiencing severe GSM frequently report vaginal discharge as a primary symptom.
Right. I actually want to pull a specific quote from the clinical Q&As we reviewed for this. Dr. Gino Tutera, an OBGYN specialist, was asked, point blank. Does the discharge associated with vaginal atrophy resemble cervical mucus?
And his answer.
His answer is definitive. He says the answer is absolutely no.
And, well, the biochemistry backs him up 100%. If we connect this to the bigger picture, think back to the machinery of the cervix we just talked about.
The Cripps cells.
Right. Cervical mucus, its volume, its spin-Barkite stretchiness, its clear consistency, is entirely reliant on peak estrogen to stimulate those Cripps cells.
So if there's no estrogen,
Vaginal atrophy is, by definition, the absence of estrogen. Therefore, the true, healthy cervical mucus simply vanishes. It's gone. The factory shut down.
okay, here's where it gets really interesting. Then what are they seeing? If true cervical mucus is gone, why do the Mayo Clinic guidelines and all these medical texts list vaginal discharge as a symptom of moderate to severe vaginal atrophy?
That's a great question.
I mean, if it's not cervical mucus, what exactly is that fluid? How can a dry desert suddenly produce a discharge?
Well, to understand the identity of this imposter fluid, we have to revisit our rainforest ecosystem.
Yeah.
But we need to look at what happens when it dies.
Okay. So the estrogen rain stopped. The epithelial cells stopped growing and multiplying,
Which means what?
which means they aren't producing that crucial sugar anymore. The glycogen is just gone.
Exactly. Glycogen production completely halts. And without glycogen, the wildlife starves.
The lactobacilli.
Right. Protective lactobacilli die off in massive numbers.
And without the lactobacilli, there is no lactic acid.
Exactly. And this right here is the critical biochemical tipping point. Without the lactic acid shield, the vaginal pH spikes dramatically.
Because nothing is keeping it acidic anymore.
Right. It leaves that healthy, acidic 3.8 to 4.5 zone and just shoots upward. It crosses the 4.5 threshold, routinely hitting 5.0, 6.0, or even 7.5 in severe cases.
Wait, a pH of 7.5 isn't just less acidic, that's literally crossing into an alkaline environment.
It is.
And in the microbial world, an alkaline environment with zero protective bacteria is basically a giant neon open vacancy sign.
It is an open invitation for pathogenic and enteric bacteria to just migrate in and colonize the space.
Enteric meaning gut bacteria, right, like E. coli.
Exactly, like E. coli. The entire microbiome shifts from being dominated by one protective species to a chaotic mix of opportunistic microbes.
Okay, so the microbiome is completely hijacked, but how does this chaotic bacterial mix actually create a fluid?
Because the fluid that women experience during severe atrophy is technically an inflammatory transudate.
Okay, pause. You use the word transudate. What makes that mechanically different from, regular mucus or normal discharge?
That's a crucial distinction, actually. So regular mucus is what we call an exudate, or a purposeful secretion.
Purposeful, meaning the body wants to make it.
Yes. It's a fluid the body is actively choosing to manufacture and secrete for a specific function, like lubrication or immune defense.
Okay, and a transudate.
A transudate, on the other hand, is basically weeping tissue.
Oh, wow. Weeping.
Yeah, it is fluid passively leaking out of the blood vessels and cellular spaces because the tissue is inflamed, damaged, and chemically irritated by this new abnormal bacterial flora and the elevated pH.
So it's literally a distress signal. It's the tissue weeping from all those microtraumas and the high pH.
Exactly. It's an inflammatory response.
Yeah.
And clinically, this fluid looks and behaves nothing like cervical mucus.
How so?
When instead of being clear and stretchy, an inflammatory transudate is often sticky. It can be yellow or brown.
Yeah.
It is frequently tinged with blood because of those petechiae, the microhemorrhages we discussed.
And I imagine the smell changes too.
Yes, because of the diverse non-acidophilic bacteria now colonizing the space, it's often malodorous.
The sources also point out a massive mechanical difference at the molecular level with this fluid.
Oh, with the cervicovaginal lavage data.
Yes. So researchers analyzed this fluid using a cervicovaginal lavage, which, for you listening, is essentially washing the vaginal vault with sterile saline to collect and test the fluids. And they found a stark difference in protein content.
Right. The data showed that postmenopausal women, as well as women using progesterone-only contraceptives that deliberately create a low estrogen state, they have significantly less total protein in their cervicovaginal fluid compared to women with healthy estrogen levels.
But why does the protein content matter so much, like on a functional level?
Because proteins, specifically heavily glycosylated proteins called mucins, are what give healthy mucus its thick, viscous, gel-like structure.
Oh, so they are the structural building blocks.
Exactly. And they are also packed with antimicrobial peptides. So when the protein drops, the fluid becomes less viscous, less protective, and structurally weak. I mean, it is truly a completely different substance from the ground up.
Which brings us to the clinical reality of all this, because if you're a patient experiencing this, it feels chaotic and terrifying. You have pain, you have this strange discharge, and everything just feels wrong.
It's incredibly distressing.
But medically, doctors actually have ways to track this complete ecosystem swap, right? It's not just guesswork.
No, it is highly measurable. Clinicians rely on a few specific tools to objectify these changes and put hard numbers to the physical reality. And one of the gold standards is the Vaginal Health Index, or VHI.
So let's break down the VHI because it scores 5 specific parameters, right? Vaginal elasticity, vaginal secretions, pH, the epithelial mucous membrane, and vaginal hydration.
Right.
But knowing what we know now, I can see exactly why they chose those 5 specific things.
Yeah, they aren't random at all. They are measuring the exact mechanical failures of the estrogen drop. Like when they score elasticity, they're checking if the collagen is fused.
Oh, right.
When they score the mucous membrane, they are specifically looking for those petechia, the bleeding micro tears that indicate the tissue has thinned out and become friable.
And each parameter gets a score. And if I recall from the sources, a total score under 15 mathematically confirms the presence of severe vaginal atrophy.
Exactly. But, if a clinician needs to look even closer, down to the actual cellular architecture, they use the Vaginal Maturation Index, the VMI.
What does that entail? Is that a biopsy?
No, the VMI just involves taking a gentle swab of the lateral upper vaginal walls and examining those epithelial cells under a microscope.
Okay, so looking at the bricks in our wall.
Right. Now, in a healthy, estrogenized, lush rainforest environment, that swab will show a high percentage of mature superficial squamous cells.
Superficial meaning they're on the surface.
Yes, these are the strong, fully developed cells that form those thickest protective outer layers.
But in a state of severe atrophy, because the tissue is starving for estrogen, those superficial cells essentially vanish, right? I think the number was dropping below 5%.
Less than 5%, yes. Instead, what the microscope reveals is a massive dominance of what we call parabasal cells.
Parabasal. What does parabasal actually mean in this context?
Parabasal cells are the deep, immature foundation cells. They are supposed to be hidden beneath dozens of layers of superficial cells.
Oh, wow. So they shouldn't even be near the surface.
Exactly. If you are swabbing the surface of the vagina and picking up predominantly parabasal cells, it means the roof is completely caved in.
Yeah.
The protective layers have wasted away entirely, exposing the most vulnerable tissue beneath.
That paints such a vivid, almost structural picture of the damage. But, there are also diagnostic tools that don't even require a microscope, right? Like the pH gloves mentioned in the clinical reviews.
Oh, the pH gloves are brilliant in their simplicity.
How do they work?
It's just a standard examination glove, but with a tiny pH indicator strip right on the index finger.
That's so smart.
Right. A clinician can perform a routine physical exam and within seconds instantly see if the vaginal pH has crossed that critical 4.5 threshold.
And if the paper turns color?
It immediately signals that the lactic acid is gone, the lactobacilli are dead, and the ecosystem has fundamentally collapsed.
Okay, so what does this all mean for the patient? Because if this condition is so mathematically and clinically measurable, if we have pH gloves and VMI swabs and VHI scores, why is the treatment rate so dismal?
It's a huge problem.
Because the published data we reviewed stated that over 90% of menopausal women are affected by these changes to some degree, yet only 25% of patients receive adequate therapy.
Yeah. What's fascinating and really tragic here is that 25% is staggeringly low, and it represents a massive failure in patient education and diagnostic clarity.
I mean, where is the disconnect?
A huge part of the problem is that women, and honestly, sometimes even their primary care providers, completely misinterpret the symptoms.
Because they see the imposter discharge.
Exactly. A woman experiences a clumpy, discolored, or malodorous discharge along with burning and itching. Understandably, she assumes it must be a persistent yeast infection or bacterial vaginosis.
Right, because that's what we're taught to look for.
So she goes to the pharmacy, buys over-the-counter antifungals or harsh cleansers, and tries to treat it herself.
But throwing antifungals at a collapsed ecosystem doesn't rebuild the tissue. It does absolutely nothing to restore the estrogen engine.
It often makes the irritation worse. Or, even more tragically, many women simply endure the pain, the dryness, and the urinary frequency, assuming it's just the normal price of aging. They think their body's just broken now.
But by understanding the mechanics, by knowing that the fundamental biochemistry has shifted, that the estrogen engine is off, the ecosystem has starved, and this fluid is an inflammatory distress signal, you are empowered to actually seek the correct targeted treatments.
And that targeted treatment is usually localized vaginal estrogen therapy because it directly addresses the root cause at the cellular level.
It essentially makes it rain in the rainforest again.
It really does. When you apply local estrogen, the estrogen receptors in the tissue literally wake up. The non-keratinized, stratified squamous epithelium starts multiplying again.
The tissue thickens back up.
Yes. The rugae folds return. The collagen stops fusing and regains its elasticity. And crucially, the cells start manufacturing glycogen again.
Which means the lactobacilli finally have food again.
Exactly. They recolonize, they pump out lactic acid, the pH drops right back down to that safe 3.8 to 4.5 range, and the pathogenic enteric bacteria are just forced out.
And once that healthy environment is restored, the tissue stops weeping.
Right. The inflammatory transidate ceases, and the crypts can potentially resume producing normal, healthy secretions. It is not about fighting a localized infection. It is entirely about restoring an intricate ecosystem.
That is just such a powerful reframing of how we view the human body. So to pull all these pieces together from our deep dive today,
Let's summarize it.
estrogen is the master regulator. When it drops by 95% during menopause or post-surgery, the healthy, stretchy cervical mucus completely vanishes because its hormonal engine has been shut off. The tissue thins out until the foundational parabasal cells are exposed, the glycogen disappears, the microbiome starves, and the pH skyrockets.
And in that new, highly alkaline, highly fragile environment, an imposter fluid takes over. An inflammatory transidate that is literally a distress signal from weeping, damaged tissue.
It's a complete paradigm shift. And for you listening, understanding the how and the why of these mechanical changes is so vital. It removes the stigma.
It really does.
It removes the confusion from an incredibly common biological reality. If you are experiencing this, you aren't broken. Your internal ecosystem is simply waiting for the right structural resources to rebuild itself.
Knowledge truly is the most powerful diagnostic tool. When you understand the biochemistry, you can advocate for the exact right solution.
Absolutely. Which leaves us with a final lingering question to ponder. Think back to that incredible self-sustaining rainforest we explored today. If the complete disappearance of cervical mucus, the thinning of tissue to the point of bleeding, and the total hostile takeover of a local microbiome can be triggered by the absence of just one single chemical hormone,
Right.
what other invisible microscopic ecosystems in our bodies are silently governing our daily comfort, completely unnoticed by us, just waiting for the right chemical signal to change?
Now that is a fascinating thought to leave on.
Keep questioning the mechanics and keep diving deep.